Hello, so my topic for today is the importance of infection control for healthcare workers. So our overview is occupational risks and hazards, infection control practices and protocol, training and education programs, and implementation of best practices. So first we're starting with occupational risk and hazards. What challenges do healthcare workers face in terms of potential exposures that could impact their health? How do healthcare institutions prioritize the safety of their staff in the face of potential dangers within the workplace? Healthcare workers encounter various risks and hazards in their role, including exposures to blood-borne pathogens and airborne infections. The emphasis is on implementing safety protocols, training, and protective measures to minimize occupational health risks. Some real-world examples would be exposure to blood-borne pathogens. Healthcare workers, especially those handling needles, face the risk of exposure to bloodborne pathogens such as HIV or hepatitis B. Prevention is implementation of needle safety protocols, use of safety engineered devices, and mandatory vaccinations. Second real-world example would be airborne pathogen exposure. Healthcare workers may be exposed to airborne pathogens like tuberculosis during patient care activities. Proper implementation of respiratory protection measures, isolation protocols, and adequate ventilation in healthcare facilities are ways to prevent that from happening. Next, we're talking about infection control practices and protocols. What specific measures are followed in healthcare settings to prevent the spread of infections? How do healthcare workers ensure a safe environment for patients and themselves during daily activities? Infection control is paramount in healthcare with practices like hand hygiene, proper use of personal protective equipment, and adherence to isolation protocols. These protocols are essential for creating a safe healthcare environment, preventing infections, and ensuring the quality of patient care. Examples: health hygiene. Healthcare workers follow a strict hand hygiene protocol, including hand washing with soap and water for a specified duration. Clear guidelines on when and how to perform hand hygiene, emphasizing its importance in preventing the spread of infections. Isolation precautions. Isolation of patients with highly contagious diseases in dedicated rooms with restricted access. Protocol. Specific guidelines on the types of isolation, contact, droplet, or airborne, based on the nature of the infectious agent. Training and education programs. How do healthcare professionals acquire the necessary knowledge and skills to ensure effective infection control practices? What measures are in place to continuously update healthcare workers on emerging infectious threats and advancements in medical practices? Training and education programs in healthcare are fundamental for equipping healthcare professionals with the knowledge and skills necessary for effective patient care and safety. These programs cover a wide range of topics from basic infection control practices to specialized training on emerging infectious threats. Ongoing education ensures that healthcare workers stay informed about new technology, treatments, and best practices, fostering a control of continuous improvement and adaptability in the ever-evolving field of healthcare. Examples of training and education programs. Basic infection control training. Newly hired healthcare workers undergo a comprehensive training program on basic infection control education, regular sessions covering the importance of hand hygiene, proper PPE usage, and recognizing potential hazards. Emerging infectious threat training. Specialized training sessions on recognizing and responding to emerging infectious threats like novel viruses, and education of emerging infection threat training, keeping healthcare workers informed about global health alerts and providing them with the latest information on infectious disease. Implementation of best practices. How do healthcare facilities ensure that they are consistently following the most effective and evidence-based approaches in patient care? What strategies are in place to optimize healthcare processes and produce for the best possible outcome for patient and the overall healthcare system? Implementing best practices involves incorporating evidence-based guidelines into healthcare processes. This ensures consistent and effective approaches to patient care, promoting excellence and positive outcomes in healthcare practices. Example would be an antibiotic stewardship program. following evidence-based guidelines on antibiotic prescribing and regularly assessing and improving antibiotic use. Another example would be surgical site infection prevention. Implementing a bundle of evidence-based intervention to reduce the incidence of surgical site infections. And that is the end. Thank you for listening.